Well, welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and what we know, of course, is an aging population today. I want to remind everybody that today's show is sponsored by Senior Care Authority, a professional senior placement and elder care management organization that has a national network of advisors to help in determining the right path for senior living and receiving proper care. So whether it's in-home care, assisted living, residential, or memory care, get the necessary advice from a senior care advisor in your area by calling Senior Care Authority at 888-809-1231, or you could go directly to the website at www.seniorcareauthority.com. And again, want to welcome everybody to the Aging Boomers. I want to, again, thank you for all your support. So many of you downloaded the free app on your iPhone, Android phone, on your iPad. Lots of different ways to do it. Some of you have gone to iTunes, iHeartRadio, or directly to our website at theagingboomers.com. So thanks for all your support. Thanks for getting the word out to so many people. And I'm very excited about our guest today. Her name is Olivia Mastry. Olivia is a founding partner of the Collective Action Lab, a unique collaborative forum that fosters cross-sector systems and social change in the health, older adult service, and disability arenas. As part of her work, Olivia is guiding Dementia National collaboration involving public and private friendly America, better known as, I guess the acronym is the DFA, which is a national collaboration organization seeking to foster dementia-friendly, involving over 50 public and private organizations and communities across the United States. So, Olivia, thank you so much for taking the time and joining us on the Aging Boomers. Really appreciate it.
Thanks for having me.
Yeah, so tell us a little more about DFA. Tell us a little more about that organization.
Sure. So Dementia-Friendly America, or DFA, is a collaborative initiative, and it involves a number of public and private organizations that represent consumers, people living with dementia and their care partners, healthcare, government, business, faith communities, and many other organizations that are reflective of the community at large. And they've come together to foster dementia-friendly communities across the U.S. at the very local level.
Okay, so and this organization is based where you are. You're in Minnesota, correct?
I'm in Minnesota, but the coalition is actually based out of Washington, D.C.
Okay.
But all of its members, while having a national presence, have statewide reach in that they have local branches or affiliates or members in states throughout the country. So while having a national presence, there's a lot of local reach.
So, I would think that everybody should be dementia-friendly. Okay, but is it more of educating people so they know how to deal with situations with others that might be customers, whatever, of their particular location, that where people just know how to deal with those with dementia? Is that really what it's about?
Well, that's a part of dementia-friendly. Dementia-friendly communities is an all-sectors approach to supporting people living with dementia and their care partners. And by all sectors, what we mean is that a community is made up of many different aspects of day-to-day living, whether that's the business sector, a faith sector, a clinical or medical sector of community, government, planning, law enforcement, first responders, legal and financial planning. All of these components come together to create the overall fabric of community. And the focus of a dementia-friendly community is making sure each and every one of those sectors does its part to adopt dementia-friendly practices and policies so that a person living with the disease in community can continue to do the things that they want to do, the things that they like to do to interact in their daily activities of living, not just inside their home, but outside in the broader community. And they can feel assured that if they do that in a dementia-friendly community, people will have an understanding and an awareness about the disease generally and know how to effectively respond. And that means something different if you're a doctor or a banker or a neighbor. And if they know how to respond, but they also, as a community planning process, build in the needed supports for people to be able to function effectively and have quality of life for as long as possible in the disease process.
So how you're defining community, okay? Is that community from a city, or is that a community? It could be an individual business, could be a community. How are you defining community?
So the Dementia-Friendly America Initiative doesn't define community and allows for an organic definition of community coming out of communities themselves. So it could be geographic, and that geography could be a state, a county, a city, neighborhood, or even a portion of a neighborhood. But you're also right in that you can create dementia-friendly communities within businesses or organizations. So a large employer, for example, could say that they're going to be dementia-friendly and consider their workplace as a dementia-friendly community. And ideally, that would be sitting in a broader dementia-friendly community that's geographically based. And we also have communities that define themselves by affinity. So we have certain cultural groups focusing specifically within their own cultural community to ensure that they're dementia-friendly and are doing so in ways that best align with their own values and unique cultural needs and norms.
So how does a community become dementia-friendly?
Well, we never say a community has become dementia-friendly. We say communities are working to become dementia-friendly. And we do that because there's always something else a community can do. But what they can do to become dementia-friendly is really look at what each sector can specifically take on in terms of adopting dementia-friendly practices. And they can also work through a 4-phase process of convening community stakeholders, assessing their community needs, and then looking at those needs and analyzing community-wide change goals they might want to undertake to strengthen the community. And they can do all of this by working through the tools and resources that are on the Dementia-Friendly America website, which can be found at DF, E as in dog, F as in Frank, America.org. And when you go to the community tab on that page, that provides a community with sector guides, so guides for dementia friendliness for every one of the sectors I've mentioned in community, as well as an overall toolkit for a community change process. Pretty self-directed, simple tools for adopting practices that are not expensive or overwhelming for organizations and people to adopt.
So why do you think someone wouldn't want to become dementia friendly? Not that they wouldn't. Why wouldn't they, I guess?
Well, there are a lot of reasons why someone might not act in terms of adopting dementia-friendly practices. The first is they may not have an awareness of dementia generally. Part of the Dementia-Friendly America initiative is simply to raise the overall awareness levels among people and organizations that there is an increasing prevalence of dementia in our communities as our population ages. Age is one of really is the greatest risk factor for dementia, and that living in community with this disease does require some accommodation. And if we can effectively accommodate people living with dementia, people or businesses can continue to maintain their customer relationships. Faith communities will be able to maintain relationships with their faith community members. A lot of natural affinities that strengthen community can continue rather than people with dementia having to leave the community and live in more higher cost and higher care settings prematurely, it's in some cases. So raising awareness is often a key to making sure that people see the need to become dementia friendly and then are willing to do that. So that's the first barrier, is just raising awareness so that people can see, what is it I need to do, what would it take, and why.
So I would, one thing is, I want to take a step back, I guess. Maybe it's something I should have asked early on. But even though we discuss this subject matter all the time on our show, I don't want to assume somebody who's just started listening to our show might be thinking, are they talking dementia? I mean, Alzheimer's? What is it they're talking about? So maybe, and again, for those of us that have been in the industry, it's kind of I guess we take it for granted that maybe people understand this, but maybe why don't you discuss what is dementia versus maybe various types of dementia? Why don't you give an overview of that?
Sure, absolutely. So dementia is really an umbrella term that is capturing memory loss or loss of particular function, not always memory related, but that the loss of memory or function is so, it reaches a point where it actually interferes with your day-to-day living. And there are many dementia-causing diseases, Alzheimer's disease really being the biggest trigger of dementia, and that represents about 70 to 80% of all dementias that you see. But there are many other diseases. Some are diseases related or like Alzheimer's, but others are not, such as Parkinson's disease. So there are many dementia-causing diseases. All of these diseases come together to create a level of cognitive impairment in people that inhibit their ability to carry on day-to-day living without some supports or needs. We use the general umbrella term dementia because it doesn't really matter why you have this cognitive impairment. What matters is that you can be supported in community as you're living with it. And that's what dementia is and how we refer to it. So you may have Alzheimer's disease, you may have Parkinson's disease. There are other conditions that can result in dementia, and we want to be inclusive of all of that.
So what is Dementia-Friendly America's role? What is the role on a local level like yourself? What are the various roles out there?
Sure. So the Dementia-Friendly America initiative at a national level, as I mentioned, is a collaboration of public and private organizations that have really come together to create and support this set of tools and resources that can be implemented on the ground at the local community level. So the role of the national initiative is first to bring the resources up, and they're now available at dfamerica.org. And then the other role of the national group is to make sure that there is enough technical assistance available to communities as they undertake this work, that if they get stuck along the way or have questions or need resources or troubleshooting, that they have some ability to get that sort of help. So creating the resources and technical assistance is the national role. The materials are pretty self-directed. They're free. They're in the public domain. They're downloadable. And communities can co-brand, create their own identity around the materials. But that's really what the national role is. At the state and local level, the ask is of communities, however they should define themselves, would step up to the challenge and say, we want to be on the map. We want to join the map of dementia-friendly communities and take this effort on. And as a result, they would use the resources and tools on the Dementia-Friendly America website, let us know that they're using it and they're in this process, and let us know if they have questions. So we're really trying to create a lot of pins on a map showing where communities are working to become dementia-friendly. So there's a state and local role of motivated and inspired communities, as well as a national role to create and maintain the resources and technical assistance those communities may need to get the job done.
Okay, so can you give us some examples of maybe communities that have or are in the process of either becoming dementia-friendly or working towards that? Can you give us some examples?
Sure. Let me talk geography first, and then I'll talk about specific things the communities are doing. So this model actually originated in the state of Minnesota under a campaign and coalition called Act on Alzheimer's. And that's actually where the tools and resources were first developed. And in Minnesota, we have 36 different communities working to become dementia-friendly. They're rural, they're urban, they're suburban, and they're also communities of interest or affinity, as I mentioned before, cultural communities and faith communities. Outside of Minnesota, now under the new Dementia-Friendly America initiative, which just started in January of 2015, we have 7 early adopter communities at work in this area. 3 of them are cities, so we have Denver, Colorado, and Tempe, Arizona, and Boston, Massachusetts that have taken this on. We have 3 counties, Santa Clara County in California, Prince George's County, and Montgomery County, both in Maryland. And then we have 1 state, the state of West Virginia. We're talking with over 30 communities across 17 states to take this on in 2016. So you can kind of get a sense that geographically this is spreading pretty quickly, and there's quite an appetite for it. In terms of what those communities are doing, most of them are working through, as I mentioned, this community toolkit, which is really a community change process where communities come together and they ask themselves, what is the awareness level of this disease? How equipped are we to respond effectively to people living with dementia? What are our community strengths we can build on to support them? And where do we have gaps? And in that process, we have communities executing on community change goals. So the things that we're beginning to see in communities are awareness campaigns to raise the awareness. We are seeing new caregiver support programs arise. We're seeing meaningful engagement opportunities such as memory cafes, Alzheimer's choirs, buddy systems in the workplace. So new civic participation opportunities for people living with dementia. We're seeing training of businesses in terms of customer service, first responders, different types of governmental programming, public spaces, signage, bus driver and taxi education programs. So we're really starting to see this ripple effect of community change that's making sure that people living with dementia can continue to function as well as engage and have quality of life as they progress with the disease.
I think it's tremendous what you're doing. Is there an opportunity? I don't know where you're getting your funding from, but for our listeners that would like the possibility of contributing to help what you're doing, is that opportunity there, or where's the funding coming from?
Yeah, so this is a privately funded initiative, even though it's a public-private initiative. We are, in this initial stage, privately funding it through the National Council members, and always open to having more support for that effort. The private funding is driven towards making sure that the resources and tools are available, and also that we have a technical assistance network for the communities. The best way to support Dementia-Friendly America in that regard is to go on the website and contact us directly, and then we'll follow up, and that's dfamerica.org, and any help in that regard is always appreciated. But that's where how we're supporting the initiative to date. And then at the local community level, we do have local communities, and they do their own fundraising as well to support the coordination of their local initiatives. And we work with them through the technical assistance process to help them identify who would likely funders be, providing grant narrative information and sample budgets. So we try to help them at the local level get funding from corporations that may be headquartered in the area or local foundations, because we know that's where most of the support will come for this effort. It certainly did in Minnesota.
So kind of a two-part question, kind of what's planned going forward, and also kind of what's the, I guess, mission? What's your hope that we'll see even 5 years from now, results from all of your hard work?
Let me start with that mission question, because one of the ways that we talk about this, and it gives people a mental model that's familiar to them, is that when you think back 5 or 10 years ago, how much work we've done as a country to make sure that people with physical disabilities continue to have access to community life, whether that's been through automatic doors or curb cuts or ramps so that if one is in a wheelchair, they can still enter buildings. We've really changed the structure of our country so that people with physical disabilities can access community life. And now, given the nature of our demographics and what's happening from a cognitive impairment level, we need the same thing around making sure people with cognitive impairment or cognitive disabilities continue to have that access. So while the curb cut is for a physical barrier to accessing community, we've, through the Dementia-Friendly America initiative, identified what are all the steps that every sector of community needs to take to make sure that we still allow cognitive or enable cognitive access to community. And those things are a bit different in terms of it's around signage, it's around navigability of communities, it's around clear, open public spaces, it's around relational activities so that customer service staff know how to help someone struggling with a transaction rather than to hinder or to undermine their activities. So it's a different set of activities, but we're aiming for the same thing. So in 5 to 10 years, we'd hope to see that accessing community, even with cognitive impairment, is a matter of course. It's a given, and that we've made some changes to make sure that that given is happening in the same way we now look at how our structures in society support people with physical disabilities. So same kind of aim in that regard. And then in terms of just next year, short term, what's next, we hope to see a tremendous amount of communities join us on the map in becoming dementia-friendly or working to become dementia-friendly, and that they would be using the tools and resources to start this movement and this change process, and that we have an ability from a technical assistance standpoint to help them in those efforts so that they can succeed.
How long has DFA been involved? As an organization?
Well, we held our first meeting of National Council members in January of 2015, and that's when we decided that we would look to Minnesota and use it as a foundational model to replicate this national resource. We announced the effort in July at the White House Conference on Aging, and we've been bringing the resources up to the national portal so that any community can use it, and they're just up this month. So we're really in the infancy. This is our first year, and we hope to kick it off beyond our early adopter communities in 2016. So it's a very new initiative.
Are you pleased the way things are going?
Well, they're moving really quickly, and what we're finding is that there is tremendous appetite to do this work. Community members see the need. Champions are stepping up. Even elected officials see this as a priority among many priorities at the state and local level. So I'm really pleased about that and very pleased about the resources we've made available to support communities. We do know that there's a need for ongoing funding to support the maintenance of those resources and, most importantly, to walk with communities as they do this work. So we would love to see additional support in that area around funding.
And if someone wants to give their time, they want to get involved, many of our listeners, whether they be caregivers, whether they be people in the healthcare industry, and they like to get involved in this initiative, how would they go about doing that, and what are you looking for?
So every initiative at the local level starts with a champion, an inspired person or people or organizations that want to come together in their own community and really foster change that will support people living with dementia and their care partners. And to start that effort, if people want guidance around that, the first thing they can do is go to the DFA website. Again, I'll say it one more time, dfamerica.org. And there's a Get Involved tab, and if they click on that, they can reach out to us. And one of the first things we do when people reach out to us is look to see where they're from and whether there's already action in place in the local community, and we connect the dots for them. If there isn't any action, then we really give them a readiness questionnaire that they might want to take back to their local community to convene a few key stakeholders to say, do we feel ready? Do we have in place what tends to lead communities towards successful change? And then if they feel that they do and they can organize an effort, we ask them to sign on or join the MAP and get started, and we try to provide them with technical assistance as they move forward and point them to the resources and the tools. We're offering online webinars and mini workshops for communities interested in learning more about this, and those are being offered in January and February of 2016. So stakeholders from the community could listen in, learn more about the tools and resources, and then decide if they're ready to move forward. But it's a pretty self-directed process, so communities can really take this and run if they're so inclined.
Olivia, thank you so much for everything you do. It's a tremendous organization. I'm very excited as far as hearing more about its future. I think you're going about it the right way. I think it's great. So maybe, I know you repeated it a couple times, but go ahead and tell people how they could get to the site and learn more.
Sure. The website is www.D as in David, F as in Frank, America.org, and we're happy to have the chance to share this exciting initiative and movement. Thanks for having me, Frank.
Thank you so much. And I want to thank everybody out there. Thank you, Olivia Mastry, Dementia-Friendly America. And thank you again for listening in, and share with your family and friends. Just be safe out there, and we'll talk to you all soon.